All right, without further ado, let's go ahead and get things going today. Today, you have arrived here at today's webinar presentation, How ExamMed and the Shepherd Center are exploring healthcare transformation with augmented reality. Today's webinar is brought to you by CareAR, a Xerox company. Our gratitude to CareAR, a very important partner of the Service Council and making a big impact across the service customer support space with their really innovative technology. So thank you to CareAR and the whole team over there. Today's topical discussion will dig into the impact that AR is making on customer experience transformation and relate it back to the patient experience. And we are so incredibly honored and pleased to be joined by today's panel. Our featured panel includes Debbie Backus. Debbie is the Vice President of Research and Innovation of the Shepherd Center. That was my Boston accent coming out, sorry. Debbie, a warm welcome to you. Welcome to today's discussion. We have Faraz Zubairi. Faraz is the founder and CEO of ExamMed. A warm welcome to Faraz. Hello, Faraz. And we are incredibly pleased to be joined by Sam Weisberg. Sam is president and co-founder of CareAR, our sponsoring partner on today's webinar. Sam is also a board member of the Service Council and has made many contributions. Sam and I dug in on a podcast last week, which you can listen back to and access on whatever podcast channel you subscribe to. A warm welcome to you, Sam. Thank you for joining.
Thanks, John.
All right, we're going to get things going. We're going to bring back the panel in just a few minutes. Let me set up the topic, the importance of AR, the importance of meeting the customer where they want to be met, the importance of infusing digital and video into the customer support, the customer delivery process, and all the many tentacles of its value to an organization. And I just want to reflect, briefly on a recent research survey conducted by the Service Council. Every year we do a chief service officer, that person that is running customer support, service, customer service, so on and so forth. And we plug in with them on, the critical areas that they're faced with. What are the key focus areas? What are their internal and external challenges? What are their investment priorities? How are they transforming? And across those questions, we learned that the key area of focus for service leaders in 2023 was going to be performance management and innovation. So if you dig sort of deeper underneath that, performance management is really this whole notion of, wow, we got to do more with less. And there's a lot of issues with respect to skill set shortage. We'll hear more about some of the data points that support that. There's a lot of issues with respect to capacity management, meeting customer demands in terms of available workforce and skill sets and labor. So performance management has become more and more critical to the service leaders' agenda and was the #1 response of service leaders this year. Innovation was right behind it. And we tie back innovation to this whole notion of how can we further deepen our relationship with the customer? How can we avoid commoditization of the experience? And how can we meet the customer where they want to be met? Personalizing the experience and making it a compassionate and relevant experience, and doing all the things that sort of elevate the importance of care within that customer dynamic. And so we're seeing a lot of focus on innovation of delivery. We're seeing a lot of focus on digital transformations being tied back to how do we innovate around the customer. And that's another critical area of service leaders. That was the #2 response. When we asked the external and internal challenge of service leaders, externally speaking, workforce talent shortage was #1. And internally speaking, lack of resources, engagement and retention, and skill set shortage was numbers 1, 2, and 3 in terms of the internal challenges facing service leaders. So again, circling this all back to the capacity issues, the importance of infusing digital into the customer experience. There's opportunities to avoid or eliminate dispatch when you start to think about the impact of augmented reality and technologies that digitize or digitalize the customer experience. So all of these key challenges that are facing service leaders are all signaling, this intention to do more with less, but also to innovate around the customer experience and try to maintain the value-driven relationship that is led with care. We asked service leaders what are their increase in terms of budgetary expense this year. 61% of service leaders and customer support leaders responded that their year-over-year spend will increase in technology. So digital transformations are going to continue. We asked why, and a lot of these service leaders are really pointing their intentions towards, getting more predictive, proactive, and meeting the customer where they want to be met. We've all experienced, service in our own personal lives. What's the first thing you do when you're stuck on a home kitchen appliance that fails, or something that you're trying to fix on your own? You're DIYing it by going to a YouTube and looking for video, or you're looking for those customer support instances where someone can remotely support you in the resolution of whatever issue you're encountering. So this predictive, proactive, and digitized or digitalized experience is a big critical focus of the technology priority in terms of investment. And then we further asked, underneath the umbrella of technology, where are you placing your bets in terms of investments? And 31% of service and customer support leaders are prioritizing an investment in augmented reality technology in 2023. That's, I plugged in with our community by way of LinkedIn. Actually, I did a LinkedIn poll. We had about 50 respondents, and 50% of respondents referenced artificial intelligence as their key investment that's happening this current year. So augmented reality, artificial intelligence, the infusion of intelligently being able to deliver customer support is becoming more and more the hot topic amongst service and customer support leaders. And so it's a really critical topic, and I'm really, really incredibly pleased to welcome back our panel today. We have Debbie Backus, once again, Vice President of Innovation, as well as research at the Shepherd Center. I did that backwards, but research and innovation is her key focus. Debbie, if we could have a brief introduction to the Shepherd Center, our listening audience and participating audience would love to learn more about what it is you guys do.
Absolutely. Thank you so much for having me today. I'm really excited for this discussion. So I am actually a physical therapist and a neuroscientist researcher by background, and I worked at a place for the last 25 years or so, that's called the Shepherd Center in Atlanta, Georgia. We are a not-for-profit hospital that treats people after catastrophic injury or disease. So that includes people after they've sustained a spinal cord injury, a brain injury, or maybe they have a condition like multiple sclerosis or Guillain-Barré or similar disabilities. And we also treat people with multiple traumatic limb loss. So we treat people who have problems with getting around in their day-to-day life. So they may need a wheelchair or a scooter or some sort of bracing or assistive devices like crutches, canes, or walkers. But we also treat people who have significant impact on their cognition, their ability to think, whether that's clearly or quickly, have trouble with communication, or may have trouble regulating their emotions and their behaviors, making it difficult for them to fit into their environment. And they can also have problems with doing the daily activities that we take so for granted, dressing themselves, brushing their teeth, feeding themselves. So we see people along the entire continuum of care, from right after they're injured or diagnosed, all the way through their lifetime, helping them manage their new condition, and then helping them manage their condition as they age. And so we work a lot with people and platforms that can help us get those people back to the most independent status possible.
Outstanding, Debbie. Thank you so much for the introduction. Yeah, doing God's work, performing God's work. So kudos to the center and for all its impact that it's making. I'm going to pause before I introduce our next panelist. I'd like to ask my trusty colleague, Lauren Slater, if we could launch our first poll to engage our audience, our listening and hopefully participating audience. We want to understand, where are you in your AR journey? There are 4 options here, and if there's context that would be helpful for us to understand you better, please feel free to chat that in the comment section on the Zoom platform. Have you currently deployed making a positive impact to your organization? Currently deployed not making a strong impact? Not deployed but considering? Not deployed and not considering? And we'd love to understand why, if not. So we'll leave this poll open here for another 10 seconds. and we can get a pulse on our listening and participating audience in terms of where they are in their AR journey. And Lauren, we can shut that poll off and reflect and react. All right, not deployed, but considering greater than half of you. That's wonderful. Thank you for joining. And hopefully today's discussion can serve the purpose of helping you build your business case. And there's many other resources that Sam Weisberg and his team at CareAR can provide to you, as well as our panelists today. Currently deployed, making a positive impact, outstanding. That's number 2. So thank you to our audience. I really appreciate that. We'd love to capture the impact that AR is making. And if you have something anecdotally speaking that has been happening within your organization that you'd like to comment in the chat section, we encourage you to do so. Those experiences are very useful for those audience members who are trying to learn more about building a business case. So we're going to get to our second panelist introduction, and that is Faraz Zubairi. Faraz is the president and founder and CEO, of ExamMed. A warm welcome, Faraz, and an introduction to ExamMed, please.
Thank you. And don't worry, we get to wear all titles. The best one is Stanford, which means that the bills get paid.
Yeah.
But no, a pleasure to be here, and thank you so much. And excited to join Debbie and Sam, two very strong partners of ours in different ways. And it's a perfect segue to introduce ExamMed sort of as this bridge, because we're going to be bridging what the amazing work that Shepherd does, sort of along with some really cutting edge and innovative technology that Sam and team have built at CareAR. But by background, ExamMed is an award-winning intelligent care management platform. In short, we deliver a unified data-driven experience and streamline the access management and analysis of patient information. So what does that mean? That means that healthcare today is delivered in so many different silos. The delivery is very fragmented, especially from a patient experience side, and giving providers the right set of information at the right time to make the right decisions. And so ExamMed acts as a very patient-centric, centralized hub that is this aggregator and this bridge. So we can collect different sources of disparate data, whether it's EHR data, social care platforms, remote monitoring data, or really any other system, and tie that into a single point of care experience. We've been delivering the platform nationally to hospitals, independent medical groups, health systems, payers, providers as well, and really pride ourselves on delivering a simple, scalable, elegant approach that can be deployed as a turnkey solution in half the time with a really, really strong ROI. And the result really at the end of the day is measuring that value to creating real sustainable value. And we're excited that we'll be able to share some of that today. So thank you for having me.
Yeah, Faraz, outstanding. Thanks for the introduction, and looking forward to your contributions. I always get excited and eager to host the live event when we start to go through all the practicing and planning sessions, and you're in for a treat for those that have joined us today. So our next panelist we'll introduce is Sam Weisberg. Sam is the president and co-founder of CareAR, a Xerox company. Sam, a warm welcome. Thanks for being a board member. Thanks for being our partnering sponsor on today's webinar. And an introduction to CareAR would be wonderful. And yourself.
Sure, John. Thanks. Always great to be here. So I've been in the communication space for, I'll just cap it at over 25 years in the software communication space. But we really started, CareAR back in, 2019 around, solving a pretty fundamental problem. And that's around making expertise accessible instantly. And so if you think about it, there are many scenarios where you've got someone, that needs assistance, and you've got someone someplace else that could provide assistance. So CareAR, we started with really, providing a platform that brings those two parties together in a very visual, digital, and seamless way. And we focused on the problem within field services. Okay, so you've got somebody who's been dispatched on site to fix a problem. The fact is that roughly 40% of the time they need to connect with somebody someplace else to solve that task that they were dispatched to do, or it would result in a follow-on truck roll. Okay, so we built that out, and again with field services in mind, as we evolved and as we then progressed in our journey, we were acquired by Xerox late 2020, and we were able to scale the business, scale the vision, and do this on a much more global type of setting. And today, what we're doing is we're really delivering critical context at the time of need. Okay, and that's what we do today, and we do this via two ways. One is live visual context, kind of like what we're doing here, right? But purpose built. And the other is, and that's really connecting human to human wherever they are to get the help they need. The other is around providing more on a self-service basis, self-service instruction, and that's really delivering content, instructional content with context. So you allow people to really self-serve on their own, at the time of need, on the devices most convenient for them. And but so you can see, and I'm really excited about this conversation. I've been in this in kind of healthcare, to an extent for a number of years, but really excited how what we were doing from our really a holistic platform can get applied to a healthcare and delivering a more beneficial patient experience. So again,
outstanding, Sam. Outstanding. Very, very warm welcome. Thank you so much for all the contributions you make to our organization. And let's go ahead and before we jump into the panel question discussion, as we go through the Shepherd Center's transformation more deeply and more intimately, I want to ask my colleague Lauren to launch our second poll, which is to learn more about where do you believe AR can make the greatest impact. If you're considering, if you've already done it, if you are undecided on your journey at this current juncture, where do you project the impact from an AR investment? And we'd love to learn and keep this poll open here. A couple of answer choices here. If there's something other that we didn't have listed here, we welcome you to comment. We'll keep this poll open for another 5 seconds or so. And we can close it off and reflect. All right, customer experience improvement, number 1, workforce utilization, cost and quality, training and knowledge, neck and neck, if you will, for number 2. So it makes a perfectly, our research speaks exactly to those areas. And you're going to hear some of our research peppered into the questions that we ask our panel today as we go through the discussion. So very, very interesting responses, very much in line with our research. Let's go ahead into the first area. So welcoming back our panel, and Debbie will put the first question to you. But before we ask the question, customer expectations are evolving, rapid pace. I talked a little bit about how customers are seeking DIY, self-service, remote channels. That's becoming more and more the common. And they expect you to be on time every time. They expect you to be credible and capable. It resolve the issue quickly, but they also expect to be visible and transparent to that process. And I don't know if it was Uber or Amazon who's to blame for that, but this visibility, this empowerment of how something's being delivered and supported is becoming more and more the norm and expected customer expectation, if you will. So Debbie, if we could talk to you briefly about what you found your customers historically value and expect versus what they're demanding now in the future, and how's that changing over time? What is your viewpoint on this topic?
Well, I think, thanks for that question, John. I think people would be surprised to know that it's basically exactly the same now. Traditionally, people, of course, they want the best, highest quality of care, and they want to know that they're getting the cutting edge care. But they also want it to be affordable. And for many, 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 many years, centuries probably, people were willing to pay, they didn't question what it cost. They hoped that their insurer would get them to the place that would provide the best care. And if they didn't, then they hoped that they had the money to be able to afford that care. But now people want to know the value of that care. How quickly can you help me achieve my goals? And are you giving me the latest and the greatest? They want us to explore the use of cutting edge technology and acknowledge that we might need their data to do it, but we darn well better keep them safe and their data safe at the same time. So it's not much different now. I went to a conference last week and it was a great conference on healthcare innovation. And a lot of the conversation centered around transparency in healthcare. Customers want to be able to have choices in the care that they receive, whether that's between two organizations or centers, or within the center, they want to have access and the ability to decide what interventions they're going to get, and know that they're spending their money well. And it's gonna be a challenge to the healthcare system, because there's still a lot we don't know about what brings the greatest value. So an interesting time.
Absolutely. Absolutely. And there's also this element of, each customer might be unique in terms of the personalized experience they're seeking, right?
Yeah.
Really interesting points you make there, Debbie. For us, I'm curious, supplemental to Debbie's comments, I'm curious what your viewpoints are in terms of, the critical ingredients to a healthy customer provider relationship. I'll put that question to you for us. Yep.
You're muted.
We
There you
are
go.
muted. Yes, we're off mute now. We're good.
It had to be one, and I guess it had to be me. It comes down to, I think, really two words: comfort and trust. Providers are very skilled in their disciplines and in their specialties and subspecialties, and they're really seeking to provide not just adequate care, but really best of class care. And oftentimes, the system is what creates a lot of limitations and challenges. And I think, being a technology platform and a service delivery platform, it's sort of on us to help give them the tools that they need so that providers have the right set of information at the right time to make the right decisions. And from a patient standpoint or that customer standpoint, it really comes down to comfort and trust, right? When you go to the grocery store to buy the beverage of choice that you're going to buy, you buy that because that brand speaks to you. And I think in healthcare, as you were alluding to and as Debbie was talking about, the more healthcare is becoming consumerized, where people are expecting those same conveniences that they have with their banking, apps and sort of other things. They expect that with their healthcare information and their healthcare providers as well. Being able to really drive towards a delivery model that fosters and strengthens comfort and trust will really, I think, help drive outcomes in a much more meaningful way. That can be measured. And then you can leverage a lot of innovation and service delivery to really drive care much more thoroughly. So we're excited to be a part of that.
Outstanding. And Sam, in your introduction to CareAR, you talked about the field service application, how you've evolved much further than that now, but the importance of upskilling and reskilling and information and that empowerment methodology that you're creating. Can you talk about how does the importance of information and empowerment is impacting customer expectations?
There's this, it's interesting, there's this theme around this consumerization play, right? And that's being brought in. And so we think it's really important, so information and empowerment. I love those two points. But we've heard overwhelmingly, from our customers that they want information and they want it when they need it. They want it in a way that is just feels like it's just part of a kind of a workflow and in a very convenient way. And then they want to be able to make decisions on that information. And in many cases, self-service is really where they're leaning towards, not because they don't want to talk to people, not like because people don't like people, but they want to either, get that immediate gratification, or they want to do it on their own schedule. Right. So I think those are kind of the two drivers with that information, that they can make decisions, and then empowerment that they could either, get instant satisfaction either on the spot or at a time that is more convenient for them at some other time. So, we see how those two key points play a role for sure.
Yeah, we have a current research survey in market where we go to the front line and we ask agents that are in the field that are fixing customer issues, those technicians and engineers that are dispatched to customer complaints, issues, and scenarios. And we ask them what they dislike about the job. Paperwork and administrative tasks, still number one by a landslide, always. This year, uniquely, the notion of being tracked by GPS and digital technologies was number 2. That's kind of risen up. A little bit of caution in terms of why all these digital transformations. Why do you want to know when I'm speeding or, you know, idling over here before a job and my utilization rates are down? So there's kind of a little bit of pause there. The number 3, which was number 2 last year, dislike about the job, was the time spent finding information.
Yeah.
So, you know, the job of a customer support agent is being expanded in terms of their importance. It's becoming more critical to the customer relationship. It's also becoming more difficult, you know, technologically driven in many cases, more sophisticated and requires more knowledge, if you will. So in context, in the moment, data and information and that empowerment has been something that we've been hearing a lot about. But then behind that, we've been hearing a lot of customer support leaders prioritizing how can we monitor our agents and supplement their knowledge and information that they need critical to their job proactively. So, you know, looking for anomaly detection and delivery scenarios and then serving that information up proactively and predictively. So that's just something that we're tracking and tracing for our listening audience. I want to build on the customer side of things, and you know, I keep talking about personalization of the customer experience, and customers expect you to know their personal preferences, to align your offerings to match their needs. And you know, I reference it back to the Ritz-Carlton. When you show up, oftentimes they know your name and they know what you like, and you know, your preferences are already built into your experience. And of course, they're doing a great job in the hospitality space. They not only are expecting all these things, but they'll vote with their checkbook when it's not present. You know, a Johns Hopkins study found that giving just 40 seconds of compassion can lower another person's anxiety in a measurable way. And further, a University of Pennsylvania study found that spending time serving others increases one's subjective sense of time affluence, the feeling that we have plenty of time and not in a hurry, meaning we're not a nuisance to the provider, right? So Debbie, I want to circle back to you. You're in a very unique industry where your customers are experiencing, you know, life-altering personal health journeys, and compassion is just, you know, part of it, right? It's not part of it, it's all of it. How has the Shepherd Center instilled compassion as a core part of its culture?
It's such an interesting question, because rehab, that's who you are, right?
Yeah.
So in rehabilitation, when you know you're dealing with people with these catastrophic conditions, you're in it because you start from compassion. So our culture is all about meeting the person where they are and helping them get to where they want to be. That is what you do as a rehab provider. With the new era, I guess, or, you know, in these times of having more data, what we can do is be better with our compassion, more precise, more personally driven. So if we can figure out the ways to take tons of data and wean it down to understand where that person is coming from, what are their abilities physically, mentally, behaviorally, what are their challenges, where are they going home to, what zip code, you know, what is available in that zip code, what will they need when they get there. We can be more compassionate, right? We can manage them that way. We can have more understanding of what they need. And we can then find the right tools for them. So we're using data to figure those things out a little bit better and a little bit faster, so that we can get people where they want to be a little bit more quickly. I had another thought and it just escaped me, but I may come back to it.
Sure.
But that is, you know, using the data in a very meaningful way. And we're very, part of being compassionate is not asking too much of a person. So a lot of places in healthcare and in research, they want to throw every assessment tool at somebody. They want to use every new cool way of collecting data and get more and more data. And we really, our conversations are around, what is the information we really need? Where are our gaps in understanding this person? And let's be very decisive about what we're going to use, and very use limited tools to a greater ability, so that we can answer those questions without too much burden on the person who's coming in and they've had this traumatic event and they can't even conceive of what their life is going to be. And, you know, yet we're asking for 5 hours of assessments, or wear this tool and look at this data and tell us what you think. You know, we know that that's not going to help them. So everything that we do, we try to do, whether it's through assessment or coming up with their care plan, it's with an eye towards them as a person and helping them achieve their best goals.
We're going to get to that, the human to human element, the importance of that. I love it. We're going to build on that. So let's hold on that one. And if you think of whatever escaped you, just come back in and pop in when you're ready, Debbie.
Thank you.
So reflecting on the data, I talked in my opening statements about 61% of service leaders increasing their year-over-year spend on technologies, and 31% looking at AR as an investment in the 2023 period. Sam, I'm going to come to you. How can organizations strike a balance between automation and the human-to-human connection, which is often lost in that technology shuffle? Can you talk a little bit about that importance? Because Debbie just talked about the human element, and technology dehumanizes sometimes, but it doesn't have to, does it?
Right. Look, I think back to my opening comment, right? I mean, what we're providing is a platform that provides critical context. It does it in a way that's very visual, digital, and seamless. So it's part of a workflow. It's part of a process. And I think giving users optionality as how do they want to interact, right? How do they want to get information, and leave it up to them as part of this process is really important. And so we try really hard to to really make that that process as simple, as intuitive, and as instant on demand as you get with some of this consumerization offerings. And so I think that's a key way on how you do it. And if you think if I go back to the use case that we've been working on with with Debbie and her team and Faraz, I mean, one example that comes to my mind is around this use case around the wheelchair fitting, and how that comes together. So there's certain geographic boundaries, okay, that determine whether somebody goes into the hospital or somebody goes to them. Okay, so just think about that. Okay, in each of those cases, look, it's time, it's a resource, and it's effort to get a human either to come in to the hospital or to get a helper or somebody to help determine what the right form factor is for the wheelchair to that person's home, right? So what if you can either look, have a human to human where it makes sense, or and that's physical, or have something that's virtual, and you could instantly engage somebody in a way that allows them to to start on their patient journey where they are at their home, at their place of business, and get the context needed in order to really accelerate the the care. And in this case, it would be to get them in a chair so they can be they could be productive.
Outstanding viewpoints. And Faraz, I'd ask for your reaction to Debbie and Sam's commentary here. Really interesting comments from the two of them.
Yeah, I mean, it comes down to, I think people will always throw out words like efficiency and effectiveness and sort of everything else, and they're great words, especially when you're writing pieces. But when you define them both from a patient experience and a provider experience, I think they can mean really different things, right? Efficiency to us is a function of speed. How quickly do I, as a patient, have access to a Shepherd Center, in this instance, provider? How quickly does that Shepherd Center provider have access to the elements and of that individual's home, right? Can the wheelchair, in this instance, virtual wheelchair fittings, can that chair fit within their hallways? Is it the right type for their for their condition and others? And then the effectiveness really being, when you have access to data, what are you doing with those elements? It's very easy in these days to collect potentially millions of endpoints of information, but what are you doing with it? And the one thing that we've always found very beneficial, and we've seen this in some of the work that we've done with Shepherd over the years, and some of the things that we're doing with Sam and team, is that data in should really be intelligence out, right? Or outcome sort of empowerment out. What are you doing with that information so that you can drive that right decision for that patient? And I think one thing that's been said by both of them, really interestingly, that shouldn't get lost, is that meeting individuals where they need to be met, right? That is probably one of the biggest differentiators within the patient experience. And I think those companies and those platforms and those providers that set out and put that focus sort of on that individual will be the ones that will drive really, really strong, meaningful outcomes.
Outstanding viewpoints for us. Really, really appreciate those. Debbie, did you have a question or a comment?
I did.
Please.
I can hold it though.
Whatever. No, let's make this
Well,
interactive. Let's go.
I had a question for you, John.
Yeah,
I was
please.
curious when you were talking about the survey that you did,
Yes.
and you shared the results. I wondered how much we knew about those people, and I actually challenged the folks on the call how much they know about the people who work with them and the types of disabilities they might have, in answering those questions, and how their needs might differ from the person who doesn't need a wheelchair, doesn't have visual hearing or cognitive deficits. I just was curious how much you know about the population when asking the questions.
Yeah, I suspect that there's very little viewpoints in the survey data from those that suffer from some handicap, quite candidly.
Yeah.
I wish that wasn't the case. We'd love to, we're all about that diversity angle and the involvement and inclusion of that audience. That's only a suspicion, not verified, because our surveys are conducted anonymously, meaning they can submit their comments freely without penalty. So their executive leadership doesn't get access to their individual response. It's all used in aggregate, right? So,
Right.
but I think that's a really good call out you make there. I would love, and I really encourage our members and our audience to consider the inclusion of this survey to those that are perhaps hindered in their ability to perform a standard, normal day-to-day job, if you will. So I think that's a really great point you make.
Yeah, no, yeah, I was curious. I was like,
Yeah.
oh, I wonder how many of those people, whatever.
Now you've got me curious, so I'm going to put the team to that. So we'll come back to you on that one.
Good.
Outstanding. And Debbie, we're going to circle back to the Shepherd Center's transformation, which I think is just really impressive. And can you share the process that you're going through right now? So it's a pretty rigorous one, and it's one that's been ongoing. For our listening audience, can you talk just a little bit about how it's evolved over time?
Yeah, sure. And I want to add one piece to what I said in the introduction. The other piece that makes Shepherd really unique is that we already have a research institute. We actually have a bona fide research institute. We receive federal funding for very rigorous research in spinal cord injury, brain injury, multiple sclerosis. So we start with that, which I think it gives us a leg up sometimes because we understand what data is and we understand the processes about how to get data safely. And so we've already embarked in some of this journey, but our process has involved, first always keeping that the North Star is our patient. It is a human being. It is a patient. And so we always think about each individual, and overall what our population needs and what their possible barriers are. And so we start from there, and then we try to think about and have defined different problems that exist. One that's really relevant to this conversation that I think many people can relate to, probably everybody can relate to, is that during COVID, we, like everybody else, still needed to provide care to our patients. And they're much more complex than somebody, no offense to anybody with a primary care problem, but they're pretty complex in that they might have a physical disability, which means they may not be able to stand. They may be unsafe going between a wheelchair and a bed. They may not think clearly and make good choices. They may not be able to follow directions. And so for those people, it was very, very challenging. So one of our problems was, how do we get our care to those people that we can't get our hands on and we can't keep safe? So our process is very similar. This is our patient, North Star. We want to provide care. What are the potential problems? They can't get their rehab after their catastrophic injury when they go home. And so that's when we started talking with our partners like ExamMed, like CareAR, to find ways to get closer to them in the home and get that information about what their home environment looks like, what are the barriers they're facing physically and cognitively in that space, what are the limitations of their care partners, and what can we do to help? So that then we can intervene. And we heard over and over again from our clinicians, it's not so hard to help the person who can still walk, but those people that can't, it's really difficult to help them. So
I heard a couple
yeah.
of great things. Please continue if you had additional thoughts. I'm sorry.
No, and so, being able to use AR to really understand what that environment looks like could be really a huge difference between having to stay in their wheelchair, in their bed all day, and getting up and interacting with their family, which these are things we take for granted. But if it's too hard to get out of bed, you're not going to get out of bed.
Absolutely.
And there are Americans who face that problem because of behavioral issues. You add the physical and cognitive challenges from spinal cord injury, brain injury, it's a problem. So that's kind of the outline of the process that we're using for everything that we do. And always the question is this something that person can do and use? Is that a tool they can use? And is the information we get from it meaningful? Does it inform the clinician? Does it inform the patient? Does it inform the payer so that we can deliver the care that we need to deliver?
I really love a couple call outs. So you talked about customer understanding and listening. You talked about seeking those friction points and then working your way backwards in terms of how can you amend to provide value where you now better understand those friction points.
Mm-hmm.
And I just wanted to call those two things out because I think that those are really critical to any customer transformation and universal in terms of application. So cool, good on you on that. Let's go into the involvement. So who from your team is involved in this, Debbie? Can you talk a little bit about that?
Every stakeholder,
Yeah.
every single stakeholder. We have patient advisory groups already as a clinical site. We have those. I imagine lots of clinical sites do. But we engage them in this discussion about, okay, we're building an innovation institute. What does that mean? What does that look like? What are the problems that you have that we can address? Today, I've had 2 meetings already today with clinician groups around the center, our assistive technologies who are using tools and creating new solutions so that somebody can, do their own hygiene and do their own grooming or eat with their care partner. And that's a big deal, being able to eat with your care partner without them having to feed you, because as soon as somebody has to feed you, that changes that relationship. So if you have a way that you can feed yourself and still talk to your loved one as a person instead of being dependent on them, it makes a big difference. Things like that. So we've met with them and we asked them, what are the problems? We meet of course, senior management, is a very important partner. They aren't just, yes, we have their support and that's critical, but they're also partners in determining what are the key priorities for our patients and for what we're providing. We have external advisors that we engage as well, and patient groups that we engage outside of just Shepherd. So we work with groups called I Conquer MS. It's a group that's formed by, governed by people with multiple sclerosis, and they're very important partners with us. So if there's anybody we touch, we want to engage them in that conversation. And it
think
takes
that's
a long
important.
time, by the way.
and that's where I'm heading is what is the timeline of the transformation and what do you expect the impact to be?
So, okay, the timeline. So there's 2 different timelines. There's the timeline for any program. And so it's an iterative, ongoing process. And then there's a timeline for our actual physical building, our Innovation Institute, which is 2 years from now. We will have programs that we can stand up in the Innovation Institute in 1.5 years, 2 years from now. And thanks to partnering with people like ExamMed and CareAR, that's for sure. And so it's not a beginning and ending thing. It's an ongoing thing. And that's the only way we can do it, right? As opportunities for cure in spinal cord injury, brain injury, in MS evolve, that opens up different kinds of problems for rehab, and the technologies evolve. What was the second part of your question? One was the time.
The impact. So the anticipated impact. Yeah.
So we know, and we are already starting to see the impact internally. In fact, in terms of delivering that more personalized care, collecting out meaningful outcomes to be able to demonstrate that what we're doing is either working or not working, and demonstrate value. we're also, the impact is going to go beyond the walls of Shepherd Center. We hope that we're going to break down barriers for our patients so that when they go home, wherever they go, they're going to have what they need to age gracefully with their disability. But we also know that not everybody can access a Shepherd Center or Shirley Ryan or Craig Hospital. There's just a handful of hospitals that treat people like this in a comprehensive way, the way we do at Shepherd Center. And a lot of people don't have access to this care. So by partnering and coming up with telehealth, telerehab tools, using data in meaningful ways for precision rehab, and standing up programs that can allow somebody to come to Shepherd to get fully assessed, to get use our data for predictive analytics so that we can tell people this is what you look like, this is how you compare to what other people, all the patients we've seen look like, and this is what we suggest to you when you go back to Australia or India or wherever you might go. We can provide them with those solutions. So I'm hoping our impact goes far beyond just what we can do day to day in our care, but also reach people far and wide to have an impact so that they can have the best health and wellness that they should after catastrophic injury or disease.
Have there been any learnings that you've gathered and kind of pulled out in terms of this process, good, bad, and indifferent?
Every day.
Yeah.
Every day.
Yeah.
So naively, we went into this a few years ago, we like everybody, we knew the importance of data. We got to collect this data. And one of the things we do, I speak best when I tell the example and the case.
Sure.
So when we have wanted to collect patient-reported outcomes, which are surveys, we learned from people with multiple sclerosis that they really like to know how they're doing and that they would be willing to do these surveys. We heard them, we stood up surveys, we asked them to complete them every 6 months. Our thought was, by doing this, it's a chronic condition, we would have tools that could identify problems when they occur and intervene faster if we know what's happening when they're in their home environment, so on and so forth. So we could say, we notice you're not walking as much, you have pain, you're depressed, come see us, let us help you, or let us call you and tell you a solution. But what we didn't realize is that meant that we have to return that data to them in a very meaningful way. Otherwise, they're not going to keep doing those outcome measures. That's an important lesson. So it's not just collecting the data, we check, but that it has to be meaningful data. And we still don't always know what that meaningful data is. So we learned that we need to figure out which tools, like, if you collect 10 assessments, are all 10 necessary? Which ones are correlated? Can you get it down to 1 or 2, saving them time, decreasing the burden? And then how do you get that back in a meaningful way and in a timely way to the person who's giving you that data? So we learned that, and those are the things we're learning. We're also learning that just because a clinician thinks it's a problem doesn't mean that the people we serve think it's a problem or that they think it's a big problem. Yeah. So really, we knew it, that we had to ask the stakeholders, we knew it to engage them, but how you do that and when you do that is also very critical. Yeah. So we're learning just some of the process things that you don't realize until you leave that step out. And we're also learning just how much people don't understand or know. We always knew that about disability, but for instance, when the whole issue of diversity and inclusion came to, really people have a better understanding of addressing people from wherever they are again, and whoever they are. Nobody included people with disability. And people with disability went outcry. So we make sure that we really consider that in every single interaction. It's not that the people with disability don't understand it, it's just how many people don't understand and don't consider the fact that that's another way that people are diverse and have a need.
Yeah, geez, there are so many good nuggets in there. We're going to be summarizing the webinar in a summary blog for our listening audience with critical takeaways. But I was like feverishly taking notes, and I was looking at how uncanny it is. Okay, humans more important than assets. Okay, let's just start there. I'm going to make that comment so that our listening audience doesn't think I'm cold, if you will. But there are so many parallels because you're trying to improve the customer experience, human to human patient experience. and you're tracking and tracing data and information, and then you're bringing it back in and then serving it back to improve that patient experience. And the same goes with respect to many of the manufacturing industries that we engage with. Criticality of asset, right? Some are more critical than others. Some are patient monitoring systems in hospitals in the medical and healthcare space. And some are revenue generating, right? So critical to the business in terms of health. But tracking, tracing, extracting data, and then empowering improvement moving forward is exactly what I just heard in your story. And it's just, there's so many parallels. We're going to come back and ask Sam to reflect on their impact. But before we get there, we'll ask Faraz. Faraz, ExamMed is a vital partner of the Shepherd Center. Can you talk about the role that ExamMed's playing in this transformation?
Yeah, yeah. I mean, I think, to piggyback on a couple of things that Debbie was talking about. One is that at our core, we want to make it emotional, right? It's because that emotion needs to come out within that experience, that provider experience, that patient experience. When you look at, as you said, assets, right? Technology being one of them. Oftentimes it's just, oh, it's a system, it's a website, it's an app, it's a whatever it is. I mean, it's a gadget, right? But if you make it emotional, then you're able to drive value and outcomes in a very different way, right? And people always say, oh, I'm fed up with this technology and all these other things, but let's actually go define for a moment what I am fed up means, right? If you imagine the I, something that's actionable, the A, and can be meaningful, the M, the hardest part is really that focus, the fed, right? Which is the focus, execution, and delivery. And then there's only one way, which is up. And for us, that's really looking at, working with Shepherd and their providers over the last 3+ years, nationally, with their providers that have provided care as far out as Alaska, internationally, and sort of in other areas. Yeah, I mean, it brings us a great deal of pride and joy to know that, what we set out to create has emotion tied to it that is driving these outcomes. And the one thing that I would also like to piggyback that Debbie was talking about, it's not just the patient experience at times, right? It's also the caregiver experience. And to many of the to the customers and clients and others that Service Council, Xerox, and others work with, those are individuals that are caregivers to people that may have disabilities. And if they're having to stay home for whatever rhyme or reason for a particular need to take care of someone, there's productivity measures and sort of other things that come into play. But our journey with Shepherd has been nothing short of amazing. Debbie and team have been great to work with. Where we can turn the dial up on functionality, we've tried to turn the dial up. One of those examples she was talking about, surveys, I think 2 years ago we integrated into their CRM system. So post a video visit or virtual encounter, a patient could opt in, and we saw really high adoption and utilization rates on that. And so things like that really drive change in a measurable way are things that we're very excited and eager to continue to explore with our partners.
Yeah, and you just a lot of critical takeaways in your commentary as well. And you talked about the parallel that exists between the caregiver, the service agent, and the end patient or the end customer. We have drawn so many comparisons and so many parallels between those two audiences. Circling back to the earlier point of removing friction, well, friction is a critical element that is lessening engagement. And there's obviously a talent shortage in the caregiver and agent spaces in terms of profession. And so the more we can make the life easier, this whole methodology of customer effort, customer being internal or external, the more we can reduce the effort, the better the improved customer experience and outcomes. So lots of cool points there. Yeah.
Plus the access that you're increasing pretty much immediately. Right? So
yeah,
that's probably one of the bigger drivers here.
Outstanding viewpoints for us. We're going to circle up to Sam Weisberg from CareAR for some closing comments in terms of how does AR change this journey? What are you hearing from your customers? What do you expect in terms of AR's impact on the patient experience, Sam?
So, I mean, all you have to do is just listen to what Debbie and Faraz are talking about, and it actually puts this into context, right? So, look, in John, in most of the time that you and I speak about, right, it's field services is about deflecting dispatches, improving first time fixes, right, and and you got KPIs associated with that, right. And a lot of times that's a cost saving, either, saving money or making money or increasing somebody's productivity. The context of healthcare, it's much different, right? You're talking about some of the things that, that Debbie talked about, which is getting somebody upright, right? Getting somebody, mobile. And, what's the KPI around that? Right? Could be, and so it just has, very different context on there. And so when we think about how you apply CareAR to it, I go back to, I talk about, making expertise accessible. In this case, I think about making healthcare, expertise accessible for patients instantly. And what does that mean? Doing it with optionality between live human to human or, self-guided instructional content that's, contextual when they need it, how they need it, in the time that they need it, right? And so, it has a lot, different meaning, and so I think, AR could be applied pretty, pretty holistically to a broad set of type of use cases within healthcare. And I think there's another key component here that I want to do a little bit of a shout out, if I may. So you've got the partnership that we're doing with ExamMed, which we're doing together with a virtual care management platform that they provide, and the AR. But there's also another piece we kind of take for granted, which is connectivity. Okay. And so we're also pretty excited to be working with our friends at T-Mobile in bringing this together. So you've got making expertise accessible in this case, and now you got to make packages simple, right? So they could be prescribed in a way where, it's just, simple to provide, simple to consume, and it's all there pre-built and ready to go. And I think that's kind of another aspect of things that you don't think about that too often, but how do you make these packages, simple and pre-configured, predefined as much as possible.
Faraz, any additional viewpoints or supplement to Sam?
Yeah, I mean, I think the connectivity piece is some of the most critical, right? Because when you get into areas of rural markets and patients come into urban centers for their care, but when they go back to their homes, connectivity is an issue. And so being able to leverage partnerships like that, I mean, it'd be awesome if I have a wireless 5G wireless T-Mobile device where I'm looking at a patient inside the home. We can fit them with their wheelchair, get them the care they need, refer them to, whether it's other social care elements or other medical or mental care elements that they need, and aggregate that information. I mean, you really talk about changing the delivery of healthcare. That's how it all comes together, right? One step at a time. But for us, just in closing, thank you for sort of having us as a part of today. What we set out to really change the delivery of healthcare to make it more purposeful and more emotional, and we're excited to build on the things that we're doing with not only CareAR, but more so with the provider community and the likes of Shepherd and others on driving outcomes in a very, very strong way. And I think, to you, Service Council, healthcare and patient experience and consumerization are oftentimes abstract and vague sort of themes and can go a lot of different ways. But you should listen to Debbie for hours, because she'll give you a lot of really strong nuggets on how you can take those needs and drive innovation and value behind it. So thank you to everybody today.
Yeah, I want to thank our panel, Debbie Backus from the Shepherd Center, Faraz Zuberi from ExamMed, and Sam Weisberg from our sponsoring partner on today's webinar, CareAR. Thank you so much for listening. Today's webinar will be accessible in a archived recording if you'd like to share it with colleagues, if you'd like to listen back to it. We'll also be publishing a couple of companion resources for you, a summarized blog that has some of the captured key takeaways and critical elements that were talked about in today's webinar, as well as some of our research aggregated in a way that's consumable for you as a 1 to 2 pager. So look for those through CareAR and through the team here at Service Council. And once again, thank you to our panel. Really a great discussion, an important one. So thank you very much.